Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 briefing along with some other city news for Thursday, July 16th. We'll start, as we always do, with our testing numbers. These are system-wide numbers for our healthcare organizations, Forrest General, Marriott Health Wesley, Simrai Hattiesburg Clinic. We also have obtained testing information for the Southern Miss Health Center, the Moffitt Health Center, that's included in these numbers as well. As of today, since the beginning of March, we've had a total of 30,513 tests conducted for COVID. Just over 3,000 of those have come back positive. Again, those are not all in Forrest or Lamar counties, and they're not all active cases. 25,505 have come back negative. We have 1,808 tests that are pending right now. In the hospital, 65 patients, just a few down from yesterday, still over the average for the last 2 weeks. That 65 is combined, Marriott Health Wesley and Forrest General. We have another 30 patients who are under investigation. Typically, those percentages, once those under investigations actually go through the testing process, about 15% of those are coming back positive, so you'll probably see the 65 go up a little bit as those are added to. We do have 33 patients in the hospital right now who are in the ICU. These are COVID positive patients, well over where we've been the last 2 weeks. And so as we look at this, our hospitalizations, while those may be down from the just over 70 that we saw earlier in the week, our ICU number has hit again another high at just over 30. We did get word yesterday and today that Forrest County had 2 new deaths, one yesterday, one today. These are the first deaths since late June, bringing our total of 45 total deaths. We do want to send our condolences to those families for the loss of their loved one. New positive cases today. It was another big day, and not in a good way. Forrest County added 35 new positive cases. Lamar County added an additional 43, which brings our metro area just for today up to 78. Totals from when this started: Forrest County is now at 1140. Lamar County is at 668. Metro area total is at 1808. Our 5-day average is where we take the number of new positive cases on a given day, and then we take the 2 days prior, the 2 days after, we average those together. It gives an idea of kind of where the trends are headed. Again, Forrest and Lamar counties continue to climb. Both of those are now in the high 20s. These are new cases per day. That's how fast this is growing. Combining those, Forrest and Lamar counties gives you the gray line, which is just under 60 new cases per day in our metro area. Obviously something to be concerned about. The number of cases inside 14 days, because this disease typically has a 14-day or fewer life cycle unless you have an adverse reaction. We keep track of the number of positive cases that have been reported back in the last 14 days, and it gives you kind of a rough estimate on how many active cases you could have in your community. Of course, that isn't always the case, because a lot of times it may take you 3 or 4 days to get your test result back, and so your ending quarantine date may be well before that 14-day period. Either way, right now, 310 people in Forrest County have tested positive in the past 14 days. In Lamar County, that number is 237, so we're well over 500 now as a metro area. And just 2 weeks ago, we were talking about inside 14-day numbers of 120 for Forrest County, around the same thing for Lamar. We've blown past that. The blue line is Forrest County, that's over 300. Lamar County, that number's increased to in the mid-200s, and so combined, it gives you the gray line. Over 500 people right now have tested positive in Forrest and Lamar counties in the last 14 days. That's important, because we have to remember what we're trying to do while we wait for a vaccine or a reliable therapeutic. Our goals are the same. We want to protect vulnerable people, people who are over the age of 60, people with underlying or chronic health conditions that could have an adverse reaction to this, trying to keep them protected. We also want to prevent overrun of the healthcare system, which has been quite kind of the story this week, as we've seen both our ICUs hit their first capacity, working now on their surge plans and moving into those. Finally, we want to continue prioritizing public health, because if we can keep people from testing positive and keep our healthcare system in good shape, we can keep all of our private sector open while we're still prioritizing public health. We continue to lean on the widespread availability of testing. You have the Cough and Fever Clinic. Marriott Health Wesley, at several of their clinics around the Pine Belt, now have the rapid testing if you're symptomatic. The C.E. Roy Community Center testing center will be open tomorrow from 8 to 2. We continue to push the wearing of masks. I think the governor is starting to lean heavily on particular counties. I know Forrest County is in that conversation, even though an order hasn't been issued yet. Of course, that wearing masks is the order here in Hattiesburg. we continue to watch our own data, listen to all voices. Some non-COVID related city news, even though it is COVID related, we talk about, came to you twice before regarding the city's finances, and I want to, it'll take a little bit, but I want to update you on kind of where those things are right now. This started in late April, when we knew, we got sort of early projections that our revenue numbers for sales tax in March, again, March we were shut down for probably half a month in terms of restaurants and some other things. We received that we were going to have a significant shortfall in the month of March. And just in case you didn't know, sales tax produces a large portion of our city's budget. We're actually the number 2 sales tax producer in the entire state here in Hattiesburg. And so when we see major shortfalls happening, we have to take notice, because we're going to have to adjust some things in terms of the way the city does business. And so in March, just to kind of show you what that number looked like, in March of 2019, this is last year, and again, a March sales tax figure we don't get until 2 months after that. That's just kind of there's a 2-month lag time, and so we get the March check in May. And so $2,081,000 is what we received in 2019. This past March, of course, we received this check in May. It was $1.794 million. It's a 13.7% drop. Now, keep in mind, that was only a shutdown for half a month for like restaurants and bars. And so we made this very sort of dire projection back then, trying to plan for the worst case scenario. If we understand that a 13% drop was for half a month in March, which again we get that check in May, we forecasted up to a 30% drop for the April month, because we were under shelter in place that month, and of course we would get the April check in June. And so we, not knowing where this was going to go, we sort of forecasted worst case scenario. This is when we did our reduction in force and made eliminated a lot of positions to try and make sure that we were remaining fiscally healthy and making good, solid, fiscally responsible decisions for the city. And so, of course, then we came back in June, because we had received better than expected news regarding those sales tax revenues for the month of April, which again we received in the middle of June. And so what we received, again, just in terms of comparison, in April of 2019, again, check coming in June, $1.84 million. In April 2020, that came in at $1.548 million. Again, we were forecasting a 30% drop, and it was only a 17% drop, which was great news, which allowed us not only to sort of breathe a sigh of relief and not have to make further tough choices, but also revise our estimates going through the rest of the fiscal year. And so we were able to forecast down to 17.8% for the following 2 months. And so, you know, what was at least a $2 million deficit of what we were planning for, by June, we were hoping to turn into a $1.5 million. So then we waited another month, and this week we received the sales tax figures for May. The city received better news, just a comparison from last year. The May 2019 month, which we received in July, was $1.949 million, and in this year, we just found out it was $1.936 million. So despite COVID-19, a less than 1% drop for the month of May in terms of finances, which incredible news as we look forward to the rest of the fiscal year. Of course, our fiscal year's ends September 30th. So now we're able to revise our projections once more. And even if we forecast a 5% drop for next month's check and in September's check, which would reflect the months of June and July respectively, total sales tax loss would go to $747,192.62, well below the $2 million shortfall we thought we were going to have. And if we take into account that the reduction in force generated around $900,000 in savings, a little bit less than that once you factor in unemployment, that's going to almost perfectly match with the sales tax loss that we will see, hopefully, between FY19 and FY20. Now, what does this mean? One, it means we're not going to have to do another reduction in force for our city employees, which is great news for them, particularly as we start to retool and hopefully add some positions back going into the next fiscal year. However, uncertainty remains. We know that right now we're seeing our highest levels in many cases, hospitalizations, ICU utilizations, new positive cases. And the governor and even locally will have to make some tough decisions to try and make sure that we don't get to a point that we can't come back from. And we're going to try to keep people safe. And so uncertainty remains on what that looks like. But the good news is that we can somewhat control our own destiny regarding these things. If we will make good personal and collective decisions, if we will socially distance, if we will avoid large crowds, if we will wear our mask. And again, no plan is foolproof, as we've seen even in our own city workforce this week. But if we will do those things collectively, there's a really good chance that we can, again, bend that curve one more time in terms of hospitalizations, ICU, new positive cases. And if we will all commit to do that in our own daily lives, we can keep our economy open. It means we can also make sure that our city revenues stay on track. And so it's a lot of good news, but there's also uncertainty, as we all know right now with numbers, and I wanted to share that with you to be very transparent with where we are as a city. Our Act of Courage today, I just want to remind you there's a couple of opportunities for you to donate blood over the next week. This Saturday, July 18th from 9 to 2 at First Presbyterian Church, the Junior Auxiliary is sponsoring a blood drive. Of course, in COVID-19, there's still healthcare needs, but a lot of people are scared to donate. And so they have a shortage of blood right now. You go to bloodhero.com, use the code Junior Auxiliary to schedule an appointment. Of course, all social distancing measures will be enforced. Also, next week, WDAM has its regular blood bowl. Couldn't come at a more needed time right now, and here are all the locations and dates where they'll have blood drives. Of course, the one that I want you to pay attention to is the Mayor of Hattiesburg, is July 23rd, where we'll be doing the blood drive at Lake Terrace Convention Center. You can make an appointment at Vitalant.org. As we go into Friday, remember to wash your hands, take care of yourself mentally and physically. Please wear a mask if you go out in public. Do only what is essential, and remember right now especially, you're safer at home. Have a good day.